We are very fortunate in this webinar to have an expert in bladder management. This is Jeffrey Day-Pomey, and he is an occupational therapist who specializes in bowel as well as bladder management. His topic today is going to be over bladder management. Thank you, Jeffrey.
So thank you very much for having me here in today's webinar on bladder management. Today, we're going to be talking a little bit about the urinary system, some basic conditions that come up when the bladder is not working properly, as well as treatment options. So even if you don't have any problems with your bladder, I encourage everyone to stay tuned to the very end. We're going to be going over lots of useful tips to help keep you healthy and prevent problems down the road. To have a better understanding of why sometimes healthcare practitioners recommend what we do, I think it's important to understand the basics on how the body works. So in the urinary system, we have four main structures. The first is the kidneys, which is where urine formation takes place. So as we eat food and take nutrients in through our body, waste is left behind. And so all of this waste is mixed with water and it's sent down to the bladder. It's sent down to the bladder via two structures called the ureters. So the ureters are two long tubes, and it actually sends down urine approximately every 10 to 15 seconds. So small amounts of urine are being produced all day long, regardless of whether you're drinking water or not. So the last structure is the bladder itself. Sometimes you'll hear this referred to as the detrusor muscle. And the reason for this is the outside wall of the bladder is made up of muscle. When this muscle contracts, it actually pushes urine out of our body. When it relaxes, it allows urine to be stored inside the bladder. So the urine is going to be exiting our body via the urethra. So those are our four structures: the kidneys, the ureters, the bladder, and lastly, the urethra. Let's look a little bit in closer detail on how the bladder works. So before we've gained control over our bladder, the process you're about to see happens automatically. So there are stretch receptors in our bladder, and this tells our brain when it's time to go to the bathroom. So signals will actually get sent to the sacral region of the spinal cord, and at this time, signals will automatically go down to the pelvic floor muscles, or also the internal urethral sphincter, and this tells the structure to relax so that urine can exit the bladder. Again, before we've developed control over our bladder, this process happens automatically. As we reach the age that we develop control over our bladder, the external urethral sphincter we can contract and control to prevent urine from coming out. The pons, or the pontine micturition center, is basically the main region in the brain where this process is controlled. So when the bladder fills up, signals get sent to the brain, and we can decide when and how to go to the bathroom. So if we decide it's not time to go to the bathroom, we can send signals down to the pelvic floor muscles that tell it to contract. These are inhibitory signals. So this is a signal that says, we're not ready to go to the bathroom just yet, let's wait. And it's not until we decide that signals get sent down that allow these muscles to relax and urine can exit the body. When the bladder is not working properly, this can lead to incontinence. So incontinence is just generally defined as a loss of control of the bladder. Just to show you some of the statistics, it's very common to experience incontinence. It's estimated as many as 80 to 100 million Americans have some form of incontinence. So I encourage everyone, while it can be very embarrassing to talk about, I encourage everyone listening in to talk to their healthcare practitioners if they are having any problems with their bladder so that they can get the proper treatment that they deserve. For those with incontinence, it's estimated it results in about 8.1 million visits to the hospital every year. As well, 13,000 deaths happen annually from urinary tract infections alone. So later on in the webinar, we're going to be talking about signs for urinary tract infections as well as steps to prevent that. It's estimated as well that 19 billion is spent on incontinence products every year. As well, 1.6 billion is spent annually on urinary tract infections. So urinary tract infections and incontinence can affect many people, but the good news is that there are lots of treatment strategies available to help out. So there are 5 types of incontinence. For the webinar, we're going to be focusing on the first 4. So the 5 types of incontinence are stress incontinence, urge incontinence, overflow incontinence, functional incontinence, and lastly, mixed incontinence. Keep in mind that mixed incontinence is really defined as a combination of both stress and urge incontinence. So for those out there that might be having problems with mixed urinary incontinence, pay attention to both the stress and urge sections because the treatment options available are essentially a combination of those to target mixed urinary incontinence. Let's start by talking about stress urinary incontinence. So stress incontinence gets its name because it's pressure or stress that gets put on the bladder that causes urine to leak out unintentionally. So if you can ever recall a time where you laughed so hard or you coughed so hard or you sneezed so hard that you peed your pants, as we have the saying, if you've laughed so hard you peed your pants, this is very common and this is called stress incontinence. So essentially what happens when there's a lot of pressure exerted on the bladder and there's not enough pressure in the pelvic floor muscles, then urine leaks out. Other times where this can happen is if we are exercising or maybe we're doing a transfer from wheelchair to the commode or wheelchair to bed. Any sort of movements where we're bending or putting pressure on the abdomen or the bladder, this can cause urine to leak out. Other examples of when this might happen is during intimacy or sexual activity. So again, if you can think of really anything during the day that might happen that puts increased pressure on the bladder, this can unfortunately sometimes cause urine to leak out. While this is more common in women, it can absolutely happen in men. For men out there that have either an enlarged prostate or have had a previous prostate surgery, this is actually something very, very common. So what can we do about it? So the most effective treatment that's available for those that have stress incontinence is doing Kegel exercises. Before I move on to explain about the Kegel exercises, it's important everyone understands before starting an exercise program, it's very important you talk to a therapist or collaborate with a healthcare practitioner. The reason for this is that if you do these exercises incorrectly, or if you're doing these exercises when it's not appropriate, you can actually cause more problems. So while the Kegel exercises or pelvic floor exercises are very effective, it's important before you start these that you speak with your healthcare practitioner to make sure it's an appropriate option for you. For those that are doing Kegel exercises, there are 2 main types of exercises. There are quick flicks. Quick flicks gets its name because of how it sounds. It's a very quick contraction of the pelvic floor muscles followed by a quick relaxation. You're going to be doing these up to 30 times. The second form of a pelvic floor exercise or Kegel exercise is doing holds. So for the holds, you can try to hold it as much as 5 to 10 seconds at a time, followed by a 5 or 10 second relaxation. So again, you're going to be contracting and holding the muscles in the pelvic floor and relaxing. It's important to understand that if you are not doing these exercises correctly, for example, if you're using your abdomen or the muscles in your inner thigh or your glutes, it can actually cause more problems because you're not targeting those right muscles. So again, that's why I reiterate, very important to work with a therapist or healthcare practitioner to make sure you're doing these properly. The other thing to keep in mind, in the past, we used to teach to do this during the time of going to the bathroom and stop the flow of urine and make sure you're doing it correctly. We no longer teach that. It's very important to not tell your bladder that it shouldn't empty when it really does need to empty. So again, these exercises should only be performed after emptying your bladder. The other thing that you need to make sure you keep in mind is that it can take time to see results. I'm sure everyone out there can appreciate just going to the gym for a couple days in a row, you may not see any difference in the mirror. That doesn't mean you haven't given yourself really, really good benefits and good results. It can take about 6 to 8 weeks in the clinical studies to show a significant result or improvement for those that have stress incontinence. But it's very important not to give up and not to stop too soon. You want to make sure you're giving enough time to allow these pelvic floor muscles to develop more control to prevent problems with incontinence. One of the other things that we can do is monitor our fluid intake. So while I'm not suggesting to drink less water to avoid problems with incontinence, you just want to make sure how much you're drinking and when. As we talked about earlier, when there's a lot of pressure exerted against the bladder and the pelvic floor, it can cause leakage. So if we have less urine inside the bladder, a little bit less risk for having an incontinent episode. But again, you do want to make sure you're staying hydrated and you're monitoring how much you drink. It is recommended generally for most adults to make sure you're getting at least 1.6 liters of water every day. Keep in mind that the doctor will let you know how much water is appropriate for you. All of our needs are going to be different depending on our activity level and our age, but generally speaking, an adult usually needs 1.6 liters of water a day. Now, our bladder is going to first get the signal of when we need to go to the bathroom at about 200 cc's. For those that are using urinary drainage systems or leg bags, sometimes I'll have them labeled as cc's. For those that are keeping track in ounces, it's going to be about 200 cc's when your bladder is halfway full. Or approximately just 1 cup. So really only after about a cup of water, your bladder is going to first get that signal that it could kind of go to the bathroom right now. And as we learned from the video, if we decide it's not a time to go to the bathroom, we can allow our bladder to fill up. If we allow it to fill to the max capacity, this is considered around 400 to 500 cc's or about 13 ounces of liquid. At that time, our bladder is completely full. So the reason it's important to understand this is that if you're having a lot of water to drink during the day and you're not making scheduled trips to go to the bathroom, if your bladder is really full and you start to do a transfer or you watch a funny movie and you start laughing, sometimes this can cause leakage. So it's important to keep in mind how much you're drinking and being on a good schedule of when you go to the bathroom. One very important thing that everyone can do to kind of monitor their overall health and general wellness is making sure they have a healthy diet. Now, I know sometimes this can be easier said than done, but it's important to understand that when we have more weight or more pressure in our abdomen, this increases the likelihood of having stress incontinence. Clinical studies have shown that for those that are overweight, by losing just 5% of your weight, this can decrease the amount of incontinence episodes by as much as 50%. So again, with not taking any medicine, with doing nothing else, by just managing weight, we can really have a significant improvement in our incontinence. Other things to keep in mind, anytime we include anything in our diet besides water, it can potentially be a bladder irritant. Now, not everyone is going to have problems with the products that I have listed on this slide, but keep in mind that for many of us, we can have problems with acidic products or coffees or teas. Alcohol can sometimes affect how we go to the bathroom. So it's important to just make sure anything that you're including in your diet, you keep a good diary to see how this may or may not affect you. If you're not sure if something is causing you problems, sometimes we can teach to do what's called an elimination diet. For example, you would start with just water during the day and slowly reintroduce something that you're hoping to include in your diet, whether it be coffee or tea, and see if you have any change in symptoms. If you're not having any problems with it, it might not be a problem for you. But keep in mind, these are potential bladder irritants, which can increase incontinence episodes. As I mentioned earlier, when we are monitoring our overall weight and trying to keep a healthy lifestyle, it can really play a big impact on incontinence. The same thing is with exercise. A high body mass index is linked to more stress incontinence. So making sure we are managing our overall weight as well as exercising can play a big role in preventing problems. While there are some areas where medicines can be prescribed, keep in mind that there are no FDA-approved medications for stress incontinence. There are some doctors that may prescribe medicines that are commonly used to treat depression to help out with stress incontinence. Some medications can help with increasing the resistance in the pelvic floor or the bladder outlet. So again, there are sometimes medications that can be used. I encourage everyone to just talk to their doctor or healthcare practitioner to see if something might be available for them. But again, keep in mind that there are no currently FDA-approved medicines that are available. The most effective treatment that is available right now for stress incontinence is doing the Kegel exercises and maintaining a healthy lifestyle by eating right and exercising. The next type of incontinence we're going to talk about is urge incontinence. Sometimes you'll hear this referred to as overactive bladder. It gets its name because we can suddenly have the urge to go to the bathroom even when our bladder might not be full. So as we said earlier, the bladder will first get the urge to go to the bathroom around 200 cc's or a little bit over a cup of water. But for those that have urge incontinence, they might get the urge to go to the bathroom even when there's only a couple droplets of water inside their bladder. This can really play a big impact on when and how we need to go to the bathroom. So for those that have urge incontinence, it is defined as going to the bathroom as only as many times as 7 times in a day. Now, every one of us will go to the bathroom different times depending on how much we're drinking in the day. But if you're going to the bathroom more than 7 times in a day, you really should have this discussion with your doctor or healthcare practitioner to make sure you're not having problems with urge incontinence. So the bladder may not be functioning properly because of a neurological injury. It could be because of MS, Parkinson's, or spinal cord injury. There are many conditions that can increase the risk of developing urge incontinence. It is more common in older adults as well as those that are overweight. While it is more common in women, especially those that have previously had a C-section, men can experience urge incontinence too, especially if they have inflammation of the prostate or have had previous surgery of the prostate. So what can we do if we have urge incontinence? So it's very important to get on a schedule for going to the bathroom. Most of us don't make a schedule for going to the bathroom. Most of us, when we need to go, we just go. But for those that are getting signals to go to the bathroom all day long and are experiencing urge incontinence, it's very important that you get on a very regulated schedule to prevent problems. So usually what we recommend is to go to the bathroom a little bit more frequently in the beginning. And as you start to get a little bit better control and can hold more urine, you can spread that schedule out a little bit. For example, you can try at first going to the bathroom every 2 hours and slowly trying to build that time up every day. So for example, if you were to go to the bathroom every 2 hours for the first day or two, then the next day increase it to 2.5 hours. If you don't have any accidents, great. Increase that time and try to go as far as you can without having accidents. These can be combined with the Kegel exercises or pelvic floor exercises that we talked about earlier. So pelvic floor exercises have been shown to decrease those false signals that sometimes our brain can get that says we need to go to the bathroom when we don't really need to. So again, very important to do a couple things. Monitor how much you are drinking during the day and making sure you are on a schedule to go to the bathroom. Some of us may not get an accurate signal of when it's time to go, so that's why it's important to monitor how much we're drinking. Again, keep in mind that your bladder is going to fill up about halfway after only a little over a cup of water, and it is going to be full after about 2 cups of water. So you can monitor when you need to go to the bathroom based on your schedule during the day of how much you're drinking. One condition that is very common for those that have urge incontinence is something called nocturia. Nocturia is just a fancy way of saying going to the bathroom in the middle of the night. Now, just because you wake up in the middle of the night to go to the bathroom does not necessarily mean you have urge incontinence or that you have something to be worried about. But it is something that can happen, especially if you drink a lot of liquids during the day, or more importantly, if you're drinking a lot of water in the evening times or at night. Other examples of why sometimes you might need to wake up in the middle of the night to go to the bathroom, if you're having acidic products, alcohol, tea, or coffee, those things can stimulate the bladder and cause it to need to go to the bathroom more often. So again, while I'm not suggesting to drink less, it's important to just make sure you're looking at when you're drinking water. So for example, if you're trying to get your 1.5 to 2 liters of water in during the day, Try to get the bulk of that in during the daytime hours and avoid drinking anything after 5 or 6 p.m. Now, if you're truly thirsty and you know you have not gotten your needs in, by all means, have something to drink before you go to bed. But keep in mind that if you're drinking even just a half a cup of water at 8 p.m. and you're going to bed, it's very difficult for most people to go 8+ hours without needing to empty their bladder. So, good strategy to have in mind before going to bed. Okay, try to go to the bathroom one last time. That way you empty your bladder, really increase that chance of being able to sleep a full night without having to wake up to go to the bathroom. The next incontinence we're going to be talking about is called overflow incontinence. Now, overflow incontinence gets its name because urine overflows because there's just so much inside the bladder, it has nowhere to go, and so urine leaks out. Sometimes people can confuse this for stress incontinence because remember, if we are doing something that causes stress on our bladder and urine leaks out, sometimes people can think it's stress incontinence. But if the bladder is unable to empty, if we have what's called urinary retention and our bladder gets so full, the bladder will try to relieve a little bit of that pressure and sometimes you'll get some leaking. So it's very important to distinguish this because the treatment options for overflow incontinence and stress incontinence are very different. So if you are not sure what you're experiencing, again, very important to have this conversation with your doctor. Don't assume if you are leaking and you see some urine in your clothes that you are emptying your bladder completely. It could just be that your bladder is trying to relieve a little pressure and that it got some urine out. Okay, so for those that are experiencing overflow incontinence, you may or may not recognize that your bladder is full. So that's why it's not reliable to go off of the urge or the feeling to go to the bathroom on when it's actually time to go. This is more common actually in men, especially for those that have had an enlarged prostate, as well as those that have had a neurological injury, whether it be spinal cord injury or a stroke, or Parkinson's or MS. There's a lot of neurological conditions that can cause overflow incontinence. The most common treatment for those that have overflow incontinence is intermittent catheterization. So intermittent catheterization is different from having an indwelling Foley catheter in that we are inserting a catheter intermittently or every once in a while. The schedule for intermittent catheterization is determined by the doctor. Oftentimes when you are in the hospital, they are monitoring how much you're drinking and how often you're going to the bathroom or how long it takes for your bladder to fill up. This is used to determine what schedule you will need to use a catheter to empty your bladder. The most common frequencies are every 4 to 6 hours. But keep in mind, you should not change the schedule of when and how you go to the bathroom unless you first consult with your doctor and healthcare team. So again, very important to stay on a schedule because of what we talked about earlier. You cannot just rely on when you feel the need to go to the bathroom. So you must stay on a schedule and set alarms and reminders if you need to, but make sure if your doctor's told you to empty your bladder every 4 hours with a catheter, it is every 4 hours. One thing that's important to remember is that we no longer teach to wash and reuse catheters. So if you do have insurance, insurance will cover single-use catheters if it is justified and medically documented by your healthcare team. So very important, if you do have insurance and you have access to supplies, please make sure you do not wash and reuse your catheters, that it's one-time use only. Lastly, one thing that is so important, and I'm sure everyone has heard this before, but I can't reiterate it enough, you have to wash your hands properly. When you are inserting something inside your body, unfortunately, you increase the risk of introducing bacteria or germs inside the bladder. This increases the risk of us developing a urinary tract infection. So it's very important, even if you have very good techniques and you've used a catheter for many years, it's still very important to remember to wash your hands properly to avoid problems with getting an infection. There are many types of catheters available. I'm going to discuss at least the basic categories that you might see. There are really only 3 main categories of catheters. The first is an open system catheter. The next is a closed system catheter. And on the next slide we'll talk about in a second is a coude catheter. So let's start with the open system catheter. An open system catheter is called that because it is open. It is not already connected to a drainage bag. That does not mean you can't connect it to a drainage bag, and in fact, many people will connect these catheters to either a leg bag or a bedside drainage bag. But open system catheters are designed to where you can drain directly into a toilet or commode. So open system catheters do have benefits, but keep in mind that the system that you are using should be determined by the doctor, the healthcare team, on what's most appropriate for you. There are insurance requirements for those that are looking at an open system versus a closed system catheter, which leads to the next category. For closed system catheters, it is a catheter that is either enclosed by a bag or is already connected to a drainage bag system. Closed system catheters, as I mentioned, do have specific requirements in order for insurance to cover these, but it is an option for those that are unable to drain directly into a commode or toilet and that do meet their criteria based on insurance. The open system or closed system catheter, there's not necessarily one that's better than the other. There are examples that an open system may be a better type of catheter for you. Really, you have to ask the questions on where you are using the catheter, whether it be in bed or in a wheelchair, or if you are cathing in a car, or if you're going to be traveling. Sometimes these are questions that need to be asked in order to figure out if an open system catheter or closed system catheter is better for you. The third category for catheters is a coude catheter. Coude is French for elbow. So coude gets that name because it has a bend in the tip of the catheter. So if you look at the slide and look really closely, you'll see the tip of the catheter is curved upwards. This type of catheter is designed for those that have trouble with passing a straight tip catheter. So why would we have a tough time passing a straight tip catheter? So for men, especially men with prostate enlargement, sometimes it can be very difficult to insert a straight tip catheter. So when you're trying to insert a catheter, sometimes it can just get stuck, and as much as you try, it will not reach the bladder. When this happens, a coude tip catheter is oftentimes recommended. A coude tip catheter can be a great option for those that either have narrowing or strictures of their urethra. So if you have a narrow urethra and it's very difficult to insert a straight tip catheter, a coude tip might be really a good option for you. Within the coude tip catheter option, there's also an olive tip variation. So the olive tip gets its name from just that. It looks like an olive. So the tip of the catheter is a little bit more rounded, and this works well especially for individuals that have strictures or very narrow openings for the urethra. So the olive or rounded tip can kind of help open the urethra and dilate it a little bit so that you can insert the catheter and reach the bladder. But again, to know which type of category or system is the best for you, you have to have this conversation with the doctor and your healthcare team. There's lots of options available. There's not necessarily one that's better than the other. There's some that can be better options for certain individuals depending on what you might be experiencing. So even if you are washing your hands very well and you are using a catheter very well, it does not mean you are without risk of urinary tract infections. So let's talk a little bit about the signs and symptoms of urinary tract infections, as well as what we can do to prevent it. So some of the most common signs for UTIs are pain or burning while urinating, frequent urination or urge incontinence, feeling the need to urinate even though you know your bladder is empty. For example, if you've emptied your bladder and just 20 minutes later you're getting the urge to go, this can be an example of that. Having a low-grade fever, having a cloudy sediment look or bloody urine, sometimes this can be a sign of a UTI, or pressure, cramping, or pain in the abdomen. Keep in mind that these are not the only signs and the symptoms. As a healthcare team, they should be looking at the entire picture to make sure to rule out it's not something else that's going on. But again, if you're experiencing any of these symptoms, you really should be calling your doctor immediately to make sure that they can run proper tests and make sure that you're not having a UTI. So what can we do to prevent it? Most importantly, making sure we're drinking enough water. So again, keep in mind that urine is waste. Urine is meant to be filtered out of our body. So when you are drinking lots of water, you are going to help flush everything out through your kidneys and through your bladder to prevent waste and bacteria and germs from building up. So again, making sure you're drinking enough fluids. If you were paying attention and you remember 1.6 liters, remember to make sure you're at least getting that in a day unless you've been instructed otherwise. The other thing is to make sure you are emptying your bladder. For some of us, it may be very difficult to empty your bladder or to empty it completely. But if you do have control over your bladder, you really want to try to make sure you are emptying all of the way. If you are not sure, you really should be keeping a diary and how much you're drinking and then marking down how much is coming out. That way you can have a good idea of what you're drinking in and what you're producing is also coming and exiting out of your body. Lastly is don't hold on to your urine. So for those that choose not to go to the bathroom because they are busy doing something else, watching an important show or watching a really good webinar, you really need to make sure you don't hold on to urine. Okay, so even if there's not a lot of urine inside your bladder, when you're holding on to it for long periods of time, you can actually increase the risk of urinary tract infection. Okay, so very important. We all have busy lifestyles and sometimes it can be hard to find time to go to the bathroom. But even if you don't have the urge to go, you should make sure you're going to the bathroom at least once every 4 to 6 hours. And lastly, as I mentioned earlier, make sure for those out there that are using a catheter to empty their bladder that you do not wash and reuse it. Okay, that single-use catheter only. Let's talk a little bit about catheter care. So there are some out there to manage their bladder that they are not using an intermittent catheter, rather they have a system where the catheter stays inside their body. There's a few options for this. The first we're going to talk about is called a suprapubic catheter. So suprapubic catheter gets its name. Super means above. So above the pubic bone is where the catheter is inserted, and it goes directly into the bladder. So the bladder is continuously drained all day long, and you do not have to insert a catheter to drain it manually. It's important to keep in mind for those that have a suprapubic catheter that there's still care involved. It doesn't mean you don't have to do anything just because the catheter is inside and it's left there. You want to make sure that you are washing around the catheter every day and that you are changing the catheter 1 time a month unless you've been instructed otherwise by your doctor. Okay, and the reason for this is if you leave a catheter inside for too long, sometimes the catheter will start to have problems, it will get fused inside, and sometimes this can increase the risk of having an infection. So very important you stay on a good schedule of changing the catheter, even if you're not experiencing problems. Other thing that's very important to keep in mind for those that are using either a leg bag or a bedside drainage bag at night is to make sure it's kept below the level of your bladder. And the reason for this is gravity. If you are holding the bag above the level of your bladder, even though some bags will have an anti-reflux valve to prevent urine from backflowing, if you're holding the bag up for too long, sometimes urine can make its way back up inside your body, which increases the risk of having an infection. So very important to make sure you're keeping the drainage bag below the level of your bladder. Let's talk a little bit about Foley catheters. Foley catheters are also sometimes referred to as an indwelling catheter. Foley catheter care is very similar to suprapubic catheter care. So the Foley catheter typically needs to be changed once a month unless otherwise indicated by your doctor. You should really make sure that you're cleaning as well around the catheter site with soap and water every day. And very important, the same thing as we mentioned about the drainage bag, you really want to make sure it's positioned properly and it's not brought above the level of your bladder. Let's talk about another system that sometimes people will use to help manage their bladder. So for men, there is a system that's also called a male external catheter, or condom catheter for short. Now, condom catheters are really designed for those that are able to empty their bladder all of the way, and it's just simply a means of being able to hold and drain urine if you're not able to make it, for example, to the bathroom or drain directly into the toilet. For male external catheters or condom catheters, you want to make sure you're changing this every single day. It is very important to not leave these on for longer than a day because it can irritate your skin and it can increase the risk for developing an infection. You want to make sure you clean the skin very well with soap and water. Typically what I recommend people do is to take a shower, and during the time of a shower, you can slowly pull the condom catheter off. Once the skin is cleaned very well and it's dried, you can apply a new male external catheter. Again, the same rule applies as we talked about for Foley and suprapubic drainage bags. You want to make sure that the drainage bags are kept below the level of the bladder. Now, hopefully if you were paying attention, this next slide, you'll see something wrong with this picture. You want to make sure at all costs you avoid your drainage bag from touching the floor. Now, for those that are attaching their drainage bag to the side of their bed or underneath their wheelchair, it's very important to keep an eye on it to make sure it doesn't come loose and it doesn't touch the floor. I'm sure everyone that's listening in can appreciate there's lots of dirt and nasty stuff that's on the floor. And if your drainage bag happens to touch the floor, it can be picking up all of the bacteria and germs. When you open your drainage bag to empty it, this can sometimes allow bacteria, germs, and dirt to make its way inside the bag. If it makes its way inside the bag, this can cause problems by causing the bacteria to go back into your bladder, resulting in an infection. So very important, really pay attention to where your bag is positioned and make sure it's hooked up properly. In this next picture, hopefully everyone can see that the bag is way too full. You want to make sure that you're keeping an eye on how much is inside the bag and empty it before it is halfway full. Even though most drainage bags can hold up to 1 liter or sometimes even 2 liters of water, it doesn't mean you should let it get to that amount before emptying it. If your bag is too full and it's very heavy, it can pull on the catheter and cause the catheter to come out of your body. So it's very important to make sure you're not letting the bag get too full. The other reason why we want you to empty these bags before it gets halfway full is because if there's so much urine in the bag, it makes it easier for urine and or potential bacteria to make its way back inside your body. So it's very important you're keeping an eye throughout the day on how much is inside your drainage bag and emptying it before it's halfway full. Let's talk about the next form of incontinence called functional incontinence. Now, functional incontinence gets its name because usually for those that have this, they can tell that they need to go to the bathroom or they recognize that they should go to the bathroom, but because of physical problems or cognitive problems, they're unable to do so. So for example, let's say that you need to go to the bathroom, you know you need to go, but because you're having a hard time with hand strength, you're unable to get your pants down in time to get to the bathroom. Or for example, let's say that you've had an injury to your brain or you have memory problems. You may not realize where the bathroom is. There are some people out there that it may not seem obvious where the bathroom is located. While they may recognize they need to go to the bathroom, sometimes they just can't find the bathroom or get there in time. So these are examples of functional incontinence. So again, if you know that you need to go to the bathroom, but you're having difficulty with your physical strength or you're having problems with memory, this can be an example of functional incontinence. Another example of this can be caused by medications. So sometimes there are medicines that are prescribed that can cause us to be very groggy or sedated. So when that happens, during those times, we might not recognize that we need to empty our bladder. And if our bladder is really full and we are groggy or sedated, we might not be able to get to the bathroom safely. If you have incontinence as a result of this, this is another example of functional incontinence. So what can we do about it? Well, for those that might have physical strength problems, I highly recommend everyone look into adaptive style pants. Now in the slide, I'm showing an example of pants that have a zipper down the side. There's also another option for those that are looking for an easier time for managing their pants, and they're called breakaway pants. These are pants that you can find usually in sporting goods stores or online. And so for breakaway pants, typically they have buttons down the side and they can be opened up on both sides to make it very easy to get your pants lowered. So for those that notice they're having a tough time managing their clothes, regardless of what your method is for emptying your bladder, adaptive pants can be a really, really good option to make it easier for you. One other thing to consider is that if you are using a certain type of durable medical equipment, whether it be a commode chair or some other adaptation for your toilet, make sure that you are seated properly on it. It's adjusted to the right height for you so that you can get there safely to empty your bladder. Sometimes by not having the proper equipment or not having the right height set up, it can make it very difficult for us to get to the bathroom on time. So sometimes simple things as just making sure the height of the commode is set up okay, or making sure the angle is proper for us to do our transfer safely can make the biggest difference in the world of avoiding an accident. For those that have loved ones that might have issues with their memory and they're just not able to tell when and how to go to the bathroom, these are some just basic strategies and principles that can help make it easier. So again, it might be obvious for you and me where the bathroom is, but it may not be for someone that has problems with their memory. So sometimes putting an obvious picture or bathroom sign outside the door, especially at home. Okay, so again, if you're putting some sort of a visual aid or reminder, it can make a big difference on someone recognizing where the bathroom is. In this day and age with technology, all of us usually have the option to put in on our phones reminders. There are even programmable watches that can be used to make it easier to remember where things are and what time it is and when we should be going to the bathroom. Lastly, we want to make sure that we are monitoring how much we are drinking. Again, I'm not suggesting to drink less, but just making sure that if you've had 2 to 3 cups of water in a very short period of time, even if you have not yet felt that urge to go to the bathroom, you likely will need to go very quickly or very soon. So keep an eye on how much you're drinking so you can come up with a good schedule on when to go to the bathroom. All right, let's take a minute to answer some questions that we received. So the first question is, how do you find a good medical supply company to supply your caths? This is a very good question. So I'm going to put a list of all of the major vendors and DME suppliers that are available, as well as manufacturers for catheters. So depending on which vendor you're currently working with, really the best thing that I can tell you is to call around to figure out which vendor is going to work the best for you. So again, the list that I have here is not necessarily in order of preference. Please make sure you're reaching out to all of the vendors that are available and see if they are able to work with you on the types of products that you need. Another option that you have is to call the manufacturers directly. So for example, if you're using a very specific product, you can actually call that manufacturing rep or the company and ask them for help with finding a good vendor. So again, if you're hoping to find a different vendor or if you're looking for a medical supplier, there are many, many options that are out there. You can either call the medical supplier directly. I have the list here available on this slide, or you can reach out to the manufacturer directly. Okay, the next question that we have is, I have difficulty emptying my drainage bag because of my hand strength. Is there something out there that can make it easier to do on my own? Great question. So there used to be an electronic system available, but it has recently been discontinued. The one that I'm most familiar with is called JB3. I provided the link inside the slide. So I encourage you to go to the link. They actually have a YouTube video available that shows a little bit better detail how the product works, but it actually is really handy for those that have decreased hand strength. It's actually a system that's hooked up to the drainage bag directly. And so with just a little bit of a pull on your hands, you can actually empty the drainage bag. So again, it may not be an option for you, but I highly recommend you look at the website and take a look at the product and ask questions and see if this is maybe a good option for you. Okay, another question that we received. I notice my bladder fills up really fast when I drink alcohol. Why is that? Well, before we get started, I hope everyone knows I can never recommend or suggest that you are drinking alcohol. But to answer your question, so alcohol is a diuretic. So what happens when we drink alcohol? Actually suppresses a hormone that gets released in our body. So how often we go to the bathroom is in part determined by hormones that are released in our body. So there's actually a hormone called vasopressin. And vasopressin basically signals the kidney to hold on to water. So when you drink alcohol, you reduce the amount of vasopressin that's in your system. So basically what's happening is when there's less of that hormone in your system, it tells the kidneys to produce more water and send more water to your bladder. This usually causes us to go to the bathroom more frequently, and it can lead to dehydration. So again, there are lots of products that are diuretics. Coffee and teas can be considered diuretics. So it's important to make sure whatever you are deciding to include in your diet that you make sure you're monitoring, okay? Because if you are choosing to drink something that you know is increasing the amount of urine, you may need to go to the bathroom more frequently to avoid an accident.
All right, Jeffrey, I just want to say on behalf of United Spinal Association of Houston, thank you so much for sharing your wealth of knowledge about bladder management with us, and we look forward to potentially having you come back and do another webinar for us.
Yes, thank you very much for having me. I hope everyone got a little bit out of today's webinar, and look forward to seeing everyone again next time.